Good day, guys. Here we are going to talk about vasomotor rhinitis. It is a non-allergic rhinitis. But how do we say it is a non-allergic rhinitis? Because all the tests of nasal allergy are negative. Here I mentioned all the tests. Which are all the tests? Those are the tests which we do for allergic rhinitis. And let us talk about the investigations of allergic rhinitis. What are they? They are total leukocyte count TLC, differential leukocyte count DLC, and here we can see peripheral eosinophilia. The next test is nasal smear. Here we can usually see large number of eosinophils. And there is skin test also, which is prick, scratch and intradermal test, and also radioallergosorbent test or RAST or RAST. We can see specific IgE antibody concentration in patient serum. Next one is nasal provocation test. Nasal provocation test. It is a crude method, Here the a small amount of allergen is introduced into the nostril of the patient. Patient is asked to sniff into each nostril to observe if the allergic symptoms are produced. Now let us have a discussion on pathogenesis of vasomotor rhinitis. The rich blood supply of the nasal mucosa makes it highly vascular, and this makes it similar to rectal tissue. Similar to rectal tissue means it will be having many venous sinusoids or lakes. These lakes are just sinusoids that are filled with blood. Let this be the sinusoids, and this is surrounded by smooth muscles. And what is the role of this smooth muscles? Let me draw it in blue. And this will act as sphincters. Sphincters of this sinusoids that control the action of the sinusoids. Okay, and this sphincter will control the filling and also the emptying of the sinusoids. Thus, it will act as an erectile tissue. The next point I have wrote here is sympathetic stimulation and parasympathetic stimulation. There must be a balance between these two. Sympathetic stimulation will induce vasoconstriction and parasympathetic stimulation will induce vasodilation. Vasoconstriction means there will be shrinkage of mucosa, and vasodilation means there will be engorgement of the mucosa. Overactivity of parasympathetic system also causes excessive secretion from the nasal glands. Here I mentioned as NG. And also we can say autonomic system is unstable in case of vasomotor rhinitis. We all know that autonomic nervous system is under the control of hypothalamus, and therefore I have wrote another point here, that is emotions. So emotions play a great role in vasomotor rhinitis. And 3 points that to remember in pathogenesis of vasomotor rhinitis are that it is similar to rectal tissue, and the importance of sympathetic stimulation and parasympathetic stimulation, and the main point that autonomic system is unstable. And because of this instability and the fact we know that autonomic system is under the control of hypothalamus, and therefore the emotions also play a major role in pathogens. Next we can talk about symptoms. There are 3 main: sneezing, rhinorrhea and nasal obstruction symptoms. Here it is paroxysmal sneezing. What do you mean by paroxysmal? It means bouts of sneezing starts just after getting out of bed in the morning. Okay, and next it is not similar rhinorrhea but excessive rhinorrhea. What is excessive rhinorrhea? Rhinorrhea means it may be the only predominant symptom. It is a main symptom, just we can say. Okay, it is the rhinorrhea will be profuse and watery and may even wet several handkerchiefs. So it will be that much excessive, and it should be differentiated from CSF rhinorrhea. The nose may drip when the patient leans forward, and thus it should be differentiated from CSF rhinorrhea, as I said. The next symptom of vasomotor rhinitis is nasal obstruction. It is usually more marked in night time, and this alternates from side to side. It is more marked in night time. It is the dependent side. Okay, it is the dependent side of the nose where the patient feels nasal obstruction, which is often blocked when lying on that side. Okay, the next is postnasal drip, that the patient feels something fall from the back of the nose. These are the symptoms. Next we can talk about the signs of vasomotor rhinitis. The only sign is that the nasal mucosa terminates the changes. Okay, normally some cases it can be normal, but generally we can see just congested and also hypertrophic in condition. Next we can talk about the complications of vasomotor rhinitis. The main 3 vasomotor rhinitis, if the long-standing case of vasomotor rhinitis occurs is, the first one is nasal polyp and the second one is hypertrophic rhinitis. What do you mean by hypertrophic rhinitis? It is characterized by thickening of mucosa, submucosa, ceruminous gland, periosteum and also bone. The third one is sinusitis, I should say. There is 3 main complications. Next we can talk about the management or the treatment of vasomotor rhinitis. There is both medical and also surgical treatment. First we can talk about medical treatment. The first one is avoidance of physical factors which provoke symptoms. Okay, it may be sudden change in temperature, humidity, dust or blast of air, something that change your environment. Okay, avoidance of physical factors. Second one is use of antihistaminics and also nasal decongestants. They will help relieving nasal obstruction and sneezing and also rhinorrhea. The next method is usage of steroids both topically and systemically. Systemic steroids are usually used in severe cases for short duration of time only. Topical steroids, we use beclomethasone, dipropionate, budesonide and fluticasone. All these are used in spray or aerosol. Okay, all these are used in the form of spray or aerosol to control the symptoms. The psychological factors of the patient should also be removed. For this we can use tranquilizers. In some patients there is a need for tranquilizers. Now let us have a look at surgical mode of treatment. Here nasal obstruction is focused and nasal obstruction can be relieved by measures that reduce the size of the nasal turbinates. Usually the symptoms that we see in hypertrophic rhinitis and also other symptoms that cause nasal obstruction like polyps, deviated nasal septum should also be corrected by using surgical treatment. The next is video neurectomy. What is video neurectomy? In the case of excessive rhinorrhea, as I said earlier, the discharge is profuse and watery, and in the case of excessive rhinorrhea where medical treatment fails to cure or fails to treat, and here we use a surgical method of sectioning the parasympathetic secretomotor fibers to the nose, which is known as video neurectomy. This is all about vasomotor rhinitis, and thank you.